Welcome back to Bridge Out Ahead, where we dig into what's under construction in life, business, and community. I'm your host, Bridger Hopkins. Today, we're taking a detour episode and checking back in with a voice from our last show, Cre Larson. If you missed her story, be sure to go back and give it a listen. But today, we're zeroing in on the mission and the legacy of First Call for Help, a community resource that's been serving Minnesota for 51 years and counting.
Yes.
Hey, Cre, thanks for chatting with me again here.
Thanks for having me back.
So for folks who don't know, what is First Call for Help? And what do you guys do and who do you serve?
Okay. First Call for Help is an information resource and referral center that is located in Grand Rapids. It's been here for 51 years, and we are available by phone or walk-in 24 hours a day. We try to connect individuals in need, whether it be a basic need of housing, food, education, in all the way up through if it's a mental health crisis. All the resources from A to Z that can help answer someone's need and support them in a moment of darkness or a really tough season in their life. And we're right here in Grand Rapids.
So who do you guys serve overall?
Everybody. A to Z from 0 to 100. It doesn't matter if someone is calling to find out what time the library's open. Where do I get a tutor? Where are local AA meetings? How do I get a therapist? Is there anyone else in Itasca County interested in walking dogs? Is there a park for that? Whatever the need is or the wonder, you call and we'll link you up to that resource.
Cool. How did First Call for Help start?
First Call for Help started in 1974 with a group of individuals sitting around a table that were progressive and dedicated to mental health. And they decided that one of the best ways that they could answer needs is to have a crisis line available. And it was a volunteer line that ran in the evenings and into the night. So when someone was alone, suicidal, feeling in distress, they could call in and be linked to resources that were on the old microfiche machines. And it was a voice that was there for people. And that grew from the Nightingales into First Call for Help 211, 51 years later.
Wow. What are some of the biggest mile points that you guys have hit over the years since starting 51 years ago?
I think turning that community volunteer group into a nonprofit, which was a first milestone, I think really progressive for that time. Morphing it in with United Way 211 to become a database that can access resources from anywhere in the state, all 87 counties, then into a crisis network, a crisis line network, where we serve 39 counties in the state. In 1999, we developed our own crisis response team, which was really progressive because the state didn't think it was cool until 2010, when they thought that evidence-based practice of meeting needs of individuals in the community could be best met by a mobile team going to them. We were already doing that in 1999. That's a milestone. And then we just kept progressing into a veteran-specific team, which is the only one in the state and one of 5 in the nation. And now into an adolescent crisis team, where we're the only certified team in the state right now. We're hoping other counties follow suit with the veterans and the specific adolescents, because we believe those populations really need that specific cultural attention. And now morphing into being one of the 988 crisis line centers for the state.
You guys are busy doing a lot of stuff, it sounds like.
A lot of stuff, yeah.
So even though you're in Grand Rapids, you serve the whole state.
We do.
What are all of the services that you guys have?
Okay. Our information referral, the 211 program is the core to our existence, linking people to the resources that we need. We have the crisis lines 24 hours a day, calling 211 or 326-8565. You have a trained counselor on the line that isn't ported out into their home. They are in our building ready awake and desiring to help. We have our protected transportation program. It's one of 3 in the state, and it's unique to our county, where individuals who might need to use a behavioral health unit, a crisis bed, or a detox, they don't go with ambulance or law enforcement. We have a car with trained staff inside to provide that transportation in a way of integrity and support to get them to and from those facilities that are going to help them. We have our crisis bed, which is a 10-bed residential crisis facility that's located in Cohasset, and it's meant to make sure that if you aren't safe enough to be at home because of your mental health symptoms, but you're not sick enough to be in a behavioral health unit, that there's that in-between support that can provide 24 hours care in a home that looks like a miniature lodge in the country and keep you community-based. So I'm really proud of that. Our 988 call, text, and chat we answer. We answer after-hours social service lines for 5 counties. And we also have a line that is probably one of my favorite, and it might be because we live in northern Minnesota, but the Rural Farmers Helpline. We answer that for the entire state of Minnesota. Farmers can many times face unique difficulties, stressors, whether it be financial or mental health. And we staff that line to be a listening ear, to be someone that lends financial resources their way. We can dispatch out farmer advocates to their home, and just be the support, whether it's you're a backyard bee farmer or you have, 1,000 acres or more that you harvest, and that is the income for your family. We answer that line, and I love that line. These proud people that provide, food for our tables, they work so hard, and they need people to support them and to be there in need, and we answer that. It's a contract through the Department of Agriculture, but our center here in northern Minnesota answers that for the entire state.
You have quite a team at First Call for Help. Who makes up that team of people that you have working there?
So we have a wide gamut of individuals that make that up, and it starts from peers that have experienced things in their lives that maybe brought them a skill or knowledge they want to share. We have mental health rehab specialists. We have peer support specialists. We have mental health practitioners, mental health professionals, trained and certified crisis counselors for the line, as well as some nurses, some RN, LPN nurses that help us do our work, and then our licensed clinical supervision team. That all together, as well as our protected transportation drivers that are certified through the Department of Transportation, A to Z. And I think it's a perfect blend of every walk of life or level of experience all coming together because we share the same passion.
What does the day-to-day operation look like for everyone? You're a 24-hour-a-day operation, 365.
We are.
What's that look like?
That is a lot of magic it takes to coordinate schedules and keep staffing and keeping at a level of training and education to really do well for those we serve. And so there's a lot of team meetings, taking off on shifts, ensuring there's quality assurance, that we have enough staff at all times to answer all the phones coming in, as well as staff to meet with partners in the community, staff to dream bigger, grants management, fiscal management. It's a lot day in and day out to keep this agency moving forward and floating.
Wow. You mentioned a lot of strong community partnerships. What does that look like in practice?
We use our community partnerships every single day in practice. We don't have a partner that just sits there in limbo and on a shelf on a MOU. Our partners are partners like Grace House, where we know when someone calls, we know the shelter partner to use. Law enforcement covers a blanket of safety over our mobile team as they respond or co-respond with them. We use our housing supports, whether it's HRA or Kutaska AOA, for our referral base to make sure when individuals are calling us with housing needs or lack of housing issues that we can directly connect them. We're really proud to keep every mental health provider in the county in a database so we can make referrals directly to them based on their specialty areas. Each of the hospitals we closely coordinate with because of our crisis teams and our protected transportation, as well as civic organizations that really are good ambassadors for us and let us come and do lunch and learns, explain our services, and then they're willing to be active outreach for us in the community when they come in contact with someone in need. So our partnerships, we would not be an agency without partnerships because we're like the hub in the middle that when someone comes to us, it's really up to us to find which partner is going to be most helpful to help you reach stabilization as quickly as possible, to relieve stress, to move on and kind of move through this dark experience you're having or a dark season.
What's something that people might not really realize about First Call for Help?
That we have so many services inside. We're forever growing. When someone calls in and they're asking for a resource and we look and we appear to not have that many in a database, we dig in. We have college students that come and work for us and other community volunteers that might say, you know what, I can dig around for this resource. And so I think maybe if people in the community just think we're 211, that's an important part and core to what we are, but we're so much more.
So how can someone support what you guys are doing in your mission, whether is there financial or partnering or other ways they can join in and help?
I think as a nonprofit, we rely on financial support, both through third-party billings for what we do, grant writing, but direct financial support is always helpful to sustain our programming. But for every individual in the community, there is a role they could play by helping get the word out. I think that's a forever long road that we have to go on, is the marketing, the outreach. And so if there's individuals in the community that they're in church, they're in a grocery store, hear of someone that is struggling in an area of their life, refer them to 211, and let's introduce them to resources that they might not realize are available. Currently, we have 32,000 resources in our database.
Wow. And that can just be as simple as calling in, I have this problem going on, and you're able to connect them with the right people to talk to.
Correct.
Wow. What's your hope for the next chapter of this organization?
Oh, continued strength. I think continued outreach so that more and more individuals in the community are aware of this resource right in the backyard. And I hope that I've built it strong enough that it'll leave a forever legacy.
You have a lot of people on your team that are pulling in the same direction. Is there a story or a moment that everybody can kind of point to and look at and say like, hey, this is why we do what we do?
I think those moments happen every day. Every day there is one part of our staff that has an amazing moment. I'll share one just from yesterday. Our 211 staff that are doing weekly outreach and resourcing inside the jail as part of some new programming, trying to be progressive about bringing resources in to individuals that are in a tough season in their life. Maybe introducing them to avenues and opportunities they weren't aware of so that when they come out, they can change the trajectory of their life and maybe their path. Just yesterday, Teresa and Cam came into my office and said, wow, today at the jail, we made some connections. Like we made a difference with some of the resources we provided. Like we were able to bring hope. They were both teared up about it. Those things happen literally every day in our office, in one part of our programming or another. That kind of fuels us. And then we share it inside so that the other staff can be empowered by it and know that them showing up every day doing their work is truly making a difference to the callers that they answer to, or to the people that come in the door. We call them guests. The guests that we greet at the door, they're making a difference in their life by simply just being there to start with.
In one sentence or one paragraph, what is First Call for Help?
Oh, I think First Call for Help is a beacon of hope that draws people to it who have passion to help, and a beacon that through that passion helps others when they need it the very most. I think it's a collection of passion, compassion, empathy, and just love of helping others. That really encompasses what First Call is. And we're really not scared of much. If someone brings a challenge of a gap, we're like, we're going to get this figured out. And we'll do it through partnerships, but let's be progressive and do our part to try to make someone else's life a little less stressful, a little more joyful. That's what we are.
Cre, if somebody has some more questions about First Call for Help, what's the best way to reach out and learn more?
You can go to our websites. We have a brand new website that really was designed and critiqued by peers in our community about all of our services. That's firstcall211.net. You can call in 211 or 326-8565 24 hours a day, or simply come to our building and walk into the door and you'll be greeted. We're at 815 Northwest 4th Street in Grand Rapids.
Wow. Very cool. I appreciate your time today, Cre, and thanks for telling us a little bit about what you guys do and all the services you provide our community.
Thanks for highlighting First Call. I appreciate it.
Yeah, you bet. First Call for Help has been showing up for this community for more than 5 decades. If you ask Cre, they're just getting started. From crisis calls to compassionate connection, they're a reminder that sometimes the first step forward is as simple as asking for help. This detour episode of Bridge Out Ahead is brought to you by Legacy Bridge Real Estate, brokered by Grand Properties. Legacy Bridge Real Estate, where legacies begin. Today's theme music is We're Making Good Time by Jed LaPlante. Thanks for riding along with us today. Remember, no matter the detours, the road ahead is still yours to build. I'm Bridger Hopkins, and this is Bridge Out Ahead.